Hi, Mr. Gibbs. My name is Kimberly. I'm going to be your nurse for today. What I'm going to do is I'm just going to do a quick little focused assessment. What I'm really going to focus on is from your head to your neck, and then I'm going to do like a little skin assessment on you, okay?
Okay.
First, I'm going to get some medical history from you. Are you allergic to anything?
Yes. Penicillin, sulfa, and dust.
Okay. Do you take any medications?
Yes. I take Zegrid, and I have Flonase and an inhaler.
Okay. What problem are you here for today?
My eyes, they start getting red and itchy.
Okay. Can you tell me how long this has been going on?
About a month.
Okay. Do you have any drainage?
Yes.
Can you describe that drainage for me?
Sure. It's when I wake up in the morning, my eyes are often crusty, and it's kind of a yellow crust.
So they feel like they're matted over?
Yes.
Okay. So I'm just going to get some more history from you. Have you ever had any surgeries?
Yes, I have.
Okay.
I've had a vasectomy, a gallbladder removal, and I've had my appendix removed.
Okay. So good amount. So what we're going to do is we're going to do a vision screening on you.
Okay.
I need you to come back here
All
to the railing, and I'm going to come over here.
Right.
And so this is a Snellen chart. What it is just a chart that I'm going to test your vision with. As I can tell, you have glasses. Can you tell me, are they for reading or are they for distance?
For distance.
Okay. So I want you to keep those on. Since I can already tell you have a problem with it, I'm just going to check and see if your glasses are helping it out. Okay?
Okay.
So don't cover your eyes. I want you to tell me this line.
L-P-E-D.
Okay. So now I need you to cover your right eye.
All right.
And then I'm going to point and I want you to repeat.
F-E-L-O-P-Z-D.
Okay. This line.
D-E-F-P-O-T-E-C.
Good job. So I need you to cover your other eye.
Okay.
And I'm going to need you to read them backwards.
D-Z-P-O-L-E-F.
Okay. This one.
C-E-T-O-P-F-E-D.
Okay. Good job. So you got them all right. Typically what we do is you just need to get more than 4 right to be able to pass the line, but you got them all right, so you have no problem with that. So could you come and sit back down for you?
All right.
Okay. Come on. Come on. Okay, good job. Okay, so what I'm going to do first is I want you to take your glasses off for me since I'm going to be dealing with your eyes and everything in your head. I don't want them to get in the way.
Okay.
So what I'm going to do first is I'm going to palpate your head and make sure there's no bumps or lesions, or I'm going to check the distribution and for baldness, okay?
I have that. Yes, thank you.
So I don't feel any bumps. So the hair distribution is thin right here. I can tell you you're starting to have a little baldness. The texture feels good, but other than that, no bumps or lesions, just a little baldness, okay?
Okay.
So now what I'm going to do is I'm going to palpate your lymph nodes.
All right.
So I'm just going to come. I want you to tell me if there's any pain or tenderness, okay?
Sure.
Any pain?
No.
Can you swallow for me? Okay. Good job. Any pain or tenderness?
No.
Okay. So what I'm going to do now is I need you to, first I'm going to check, open, okay, close. In this joint, is there any pain when you do that?
No.
No tenderness?
No.
Okay. So I want you to puff out your cheeks. You suck them in. Okay. So I want you to clench your teeth. Open, close. Stick your chin out. Chin out. Side to side. Can you smile? Frown. I think. Can you tell me if there's any pain or tenderness?
No.
Pain or tenderness?
No.
Any pain or tenderness?
No.
Okay. So what I'm going to do is I'm going to check your ears. So there might be some wax. That's fine. I just want to make sure there's no fluid, like major drainage going on, or any like swelling of the eardrum. Okay.
Okay.
So the tympanic membrane looks good. I don't really see any wax really. And it's gray, no fluid behind it, and I don't see any swelling or redness. So that ear looks good. I'm going to check this ear. No drainage. The eardrum looks good. It's gray like it's supposed to be. There's no fluid or swelling, no redness. So that one looks good. So what I'm going to do now is I am going to use my pen light. So I want you, at first I'm just going to check your pupils, make sure they're reacting to light. So just look straight ahead. So they react appropriately to light. Pupils are reactive, no problems there. So what I'm going to do now is I'm going to take my pen light and I'm going to make a shape. I'm going to make the letter H, and I want you to follow the light, okay?
Sure.
Wherever I make the light go, you go, okay?
Okay.
Okay, good job. So now what I'm going to do is I'm going to check your peripheral vision. So I'm going to cover one eye, and I want you to cover right across from me.
Okay.
And I'm going to put my hand in a position. When you start seeing my fingers wiggle, I want you to say yes, okay?
Okay.
So I'm going to just do, so cover your right eye.
All right.
I'm going to cover my right eye.
Yes. 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 Yes.
Okay, cover this eye.
Yes. 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 Yes.
Okay, good job. Okay. So, I'm just going to change out the setting on my scope, and now I'm just going to check your vision with this. Sorry, it takes me a little bit. Okay. Okay, so what with this is going to do is I'm going to look at the back of your eye.
Mm-hmm.
So what I need you to do is look straight ahead. I don't want you to look at me. I'm just going to look inside your pupil, and I'm going to look at the blood vessels, make sure they look okay, and then I'm going to look at the optic disc, okay?
Okay.
Okay, so blood vessels look fine. Optic disc looks great. It's yellow like it's supposed to be. Okay, and the same with your right eye. It's yellow. I can see the blood vessels fine. Okay, so I'm just going to look at your lower lids, make sure they're normal. They are normal. They're not pale or anything. Appropriate color. So I need to look at your nose. I'm just going to look at your turbinates and make sure you don't have any drainage.
Sure.
Okay, looks good. No drainage. I can tell you have a slight nasal deviation to the left, and that's perfectly fine. So now I'm going to look in your mouth. I'm going to get a tongue depressor. Okay, so I just want you to go, ah. First, I'm going to look under your tongue. Can you lift it? Good. No lesions. I don't see any lesions to the right of your mouth. To the left. Don't see any missing teeth. Looks good. So can you go, ah? So your tongue, there's no lesions on it, no problems there. I don't see any sores. So now I'm going to look at the back of yours, right? Look at your uvula. It looks good. So now I've got to gag you. Okay. So that looks good. So now what we're going to do is we're going to do your hearing. So this is a tuning fork. What I'm going to do is I'm going to just hit it, and then I'm going to, I actually need to find some, I'll just hit it on the side over here. So I'm going to put it on the top of your head, and I just want you to tell me if you can hear it in both ears. the same amount, or if one ear is better than the other. Okay.
Okay.
Let's hit over here.
I'm hearing it in both ears.
Okay.
The same amount.
Okay. You do it on your forehead.
I can hear it in both ears.
Okay. So now I'm going to put it on the bone back here. I want you to tell me when you can't hear it anymore. And then what I'll do is if it's still going, I'll pull it out here. You tell me if you can hear it, and then we'll do it again when you can't hear it again. Okay?
Okay. Okay, I can hear it right now.
Can you hear it?
Yes. I can hear it.
Okay, good. Okay, I'm going to do it to the other ear. I'm going to just turn you a little bit here.
Okay. Okay.
Can you hear it?
Yes.
Tell me you can't.
Okay.
Okay, good job. Okay, so now what I'm going to do is I'm going to do like a whisper test on you. I'm just going to stand behind you and I'm going to whisper some numbers, and I just want you to tell me back what numbers. I'm going to give you 4 numbers.
Okay.
Okay? Okay.
5, 7, 2, 3.
Okay, good job. I'm going to come over here.
6, 8, 1, 0.
Okay, good job. Okay, so that is it on that. So now what I'm going to do is I'm going to do a skin assessment on you, okay?
Okay.
And what I'm going to do is I'm just going to do like the skin temperature, the turgor, which is how tight, like elastic. And then I'm also going to like check for moles, just like on your arms and everything.
Okay.
I might look at your back just a little bit, okay?
Sure.
So as far as skin temp, normal skin temp, no moisture, it's not dry or anything, it's just normal. Hair on the arms is distributed appropriately. Skin turgor is normal. No signs of jaundice, redness. I don't see any rashes on your legs or anything. The hair on your legs is appropriate. I need to look at your fingernails. Fingernails look good. No signs of clubbing. Cap refill is less than 3 seconds. No rashes. Do you know of any rashes?
No.
Okay. So I don't see, can you lean up for me?
Uh-huh.
I don't see any rashes. And I don't see any moles. So, it looks good. No signs of incisions from here, but we're not going to check for those. And I think that is good. Again, I don't see any discoloration. And that's good. Do you have any other questions?
No, ma'am. Thank
Okay.
you.